Good morning. I'm Professor Dr. Nuran Abaza, Professor of Physical Medicine, Rheumatology, and Rehabilitation, Faculty of Medicine, Ain Shams University. Today, we are going to review the shoulder examination, including the anatomical structure of the joint, the range of motion, and how to test for each. By the end of this presentation, you will be able to recognize different anatomical landmarks of the shoulder, identify special testing for the different muscles acting on the shoulder, demonstrate type of shoulder movement and the range, palpate properly important landmarks of the shoulder. Reviewing the anatomy of the shoulder, we can clearly see that it's a synovial joint of a ball and socket variety between the head of the humerus and the glenoid cavity of the scapula. Please don't forget that there is a structure important for better fitting of the bone in this joint, which is called the labrum glenoidal. It deepens the glenoid cavity so that the head of the humerus fits entirely or fits better in the shoulder joint. Please note that the acromioclavicular joint is as well important in suspension of the upper limb to the trunk. The acromioclavicular joint is composed of the bony distal ends of the acromion, which is the end of the spine of the scapula, together with the distal end of the clavicle. Coming to the range of motion of the shoulder joint typically allows a wide range of motion. We will start by the flexion and extension. Flexion signifies that you will raise your arm in this fashion, forward and upwards till you reach almost 165 degrees. When it comes to extension, you will move it backwards and posteriorly in this fashion, and this movement reaches 60 degrees. One of the most important range of motion of the shoulder joint is abduction. It signifies moving your arm with the elbow extended upward and away from the trunk in this fashion till 180 degrees. On the other hand, when we come to adduction, it has a range of motion of 50 degrees. This is because the trunk comes in between your upper limb and between the range of motion. As regards the internal and external rotation of the shoulder, these are more easily visualized when you have your shoulder abducted 90 degrees, your elbow flexed 90 degrees, and then we can see that the internal rotation comes to 70 degrees, while the external rotation brings 100 degrees of external rotation. This is true when your shoulder is abducted at 90 degrees. You can also do this movement when your shoulder is in extension, but this way the internal rotation as well as the external rotation will be both of 70 degrees. The shoulder joint is hence a very wide range of motion joint. That's why it is mandatory to protect this wide range of motion joint from dislocation by strong musculature and ligaments. Some of the important ligaments of the shoulder are the coracohumeral ligament, the glenohumeral ligament with its three parts, superior, middle, and inferior, as well as the transverse humeral ligament. They are extended between the bony parts denoted by their names. For example, the coracohumeral ligament goes all through from the coracoid process of the scapula, which is anterior, till the humerus, and the glenohumeral goes all the way from the edges of the glenoid cavity to the humerus as well. As regard the transverse humeral ligament, it is on the edges of the bicipital groove, keeping the bicipital tendon in place. One of the important musculature around the shoulder is the rotator cuff. It includes the supraspinatus muscle, the infraspinatus muscle, the subscapularis, and the teres minor muscle. Kindly review the anatomy, origin, and insertion of those muscles as well as their actions. The subscapularis comes from the subscapular fossa on the scapula anteriorly, and the supraspinatus and infraspinatus comes from above and below the spinous process of the scapula. Now let's start the examination of the shoulder joint. صباح الخير.
صباح النور.
اسم حضرتك ايه؟
سيد سالم.
اهلا يا استاذ سيد. ممكن النهارده نكشف على مفصل الكتف عندك؟
ممكن يا فندم، تحت امرك.
تمام، شكرا. أستاذ سيد ممكن بس نخلع هدومنا عشان نعرف نكشف كويس على مفصل الكتف ونبص على الكتف. We first start by inspection from the front, anteriorly, to check if there is any swelling, scars, or sinuses on the skin. An important point to check is to check for the sternoclavicular joint, the clavicle for any deformities, and the acromioclavicular joint. The later, which is the acromioclavicular joint, is an important point to check for what's so-called impingement that will be discussed later in the special tests. Also, it is important to check for the deltoid muscle contour, to check if there is any wasting or is any sinking or any abnormalities in the contour of the deltoid muscle. Don't forget also to inspect from the side like you inspected from the front for the same items. Also, you will have to examine from behind for the shape and position of the scapula. اتفضل يا أستاذ سيد، هنقوم نقف وهنلف. You will inspect from behind for the shape and the position of the scapula. Inspection from above will allow for further examination of the shoulder contour and for the clavicle and for the supraclavicular fossa. Now let's move from inspection to palpation. We will first palpate the temperature by the dorsum of your palm. You will then palpate the sternoclavicular joint, the clavicle, and then the acromioclavicular joint. You will also palpate for the head of the humerus and down to the humeral shaft. Now you will palpate the important anatomical landmarks around the shoulder. First start by the sternoclavicular joint, then up to the clavicle till you reach the acromioclavicular joint. Then see for the tenderness of the acromioclavicular joint, and then you will palpate for the head of the humerus. You can also palpate down to the shaft of the humerus. When you palpate for tenderness, it's important to palpate over the bicipital tendon. In the bicipital groove, you may find tenderness, which signifies bicipital tendinitis. Also as well in the greater tuberosity and lesser tuberosity of the humerus, signifying supraspinatus and infraspinatus tenderness or inflammation or pathology. Once you have reached the acromioclavicular joint, you can also palpate for any crepitus while abducting the arm. Also as well, you can check for any inflammation of subacromial subdeltoid bursa when you do the full abduction of the arm. Check for the abduction range of motion, which is from 0 to 180 degrees. And then the patient will resume to the original position. Kindly check for any painful range of motion or painful arc of motion within this whole range, which might be in between 70 and 120 or 120 and 180 degrees, which signifies impingement in the acromion region, acromioclavicular ligament, or coracoacromial ligament, or rotator cuff inflammation or syndrome. Check for adduction, which you will place your hand over the shoulder and swing the arm across the chest. It's from 0 to 50 degrees. Now let's check for flexion and extension of the shoulder joint. The flexion will be from 0 to 165 and the extension will be from 0 to 60 degrees. سيد هنرفع ايدنا لقدام لحد فوق خالص. Here you go. This is the range of flexion from 0 to 165 degrees. نزل يا سيد. تمام. Now we will check for the extension of the shoulder joint, and you should inspect for both flexion and extension from the side as well. هنودي بقى لورا يا سيد. And here are the extension from 0 to 60 degrees. شكرا يا سيد. Now let's check for the internal rotation and external rotation. You can check for internal rotation, external rotation in abduction. First, you abduct the shoulder 90 degrees and you flex the elbow 90 degrees, and then you can check for external rotation and internal rotation. You can as well check and نزل إيدنا يا سيد for these movements in adduction. ندخل إيدنا لجوه يا سيد. Internal rotation and external rotation of the shoulder. We can also check for internal rotation and external rotation by a simple maneuver indicating for the patient to put the palms behind the head and then internal rotation and external rotation. Now there is a special test for the supraspinatus muscle to check for any pathology. We will abduct the arm 90 degree, and then we'll perform internal rotation of 30 degree with the thumb pointing down to the floor, and we'll ask the patient to resist the movement of pressure downwards. أستاذ سيد أنا هضغط عليك لتحت وأنت حاول تقاومني لفوق. Yeah. شكرا. If there is any pain within this maneuver, this identify pathology in the supraspinatus muscle. The importance of the rotation we did, the 30 degree internal rotation, is to isolate the action of the deltoid so that we are checking only for the supraspinatus. Now all this movement around the shoulder joint should be checked also for muscle power, meaning doing resistance to the patient when attempting to perform flexion, abduction, adduction, and extension. That's all with the examination of the shoulder joint. Thank you and goodbye.